This is the topic of Group 2, Medication through Surgery and Artificial Methods of Pregnancy.
This is Juboy Laton Apaw, and I will discuss to you the common medication before, during, and after surgery. The drugs commonly used before, during, and after surgical procedures vary widely from patient to patient. This is because the specific drugs you receive are based on the type of surgery you are having, the anesthesia you will be undergoing, and any underlying health problems you have. So, pre-operative medication. So, this is a before surgery. You will meet your anesthesiologist. At this visit, you will review all your medical and dental problems and allergies, as well as any medications you are taking, including herbal supplements, vitamins, and any over-the-counter drugs like aspirin. So be sure to tell your anesthesiologist whether you take illegal drugs or smoke or drink alcohol, as all of these substances may affect how well you heal from your surgery and how well the anesthesia work in your body. So medication giving during surgery. So this is a during surgery. So there are different types of anesthesia. So number one is local anesthesia. So you are awake and a medication is injected into the skin to numb or block pain in the specific site of the body. So just like for example, removal of a mole in a person's back. So that is the example of local anesthesia. Number two is regional anesthesia. You are awake and a medication is injected in an area of nerves to numb the part of the body that is undergoing surgery. So I have also an example here. So an epidural during labor and childbirth. So that is the example of regional anesthesia. Last one is general anesthesia. You are asleep and a medication is given to stop pain from being felt anywhere in the body. So let's say for example, a surgery to remove a person's gallbladder or appendix. So that is the examples of general anesthesia in during surgery. And now let us proceed to the post-operative medication. So post-operative medications. So this is a after surgery. So after a person has completed surgery in an operation room, he will go to a recovery room where nurses will closely monitor vitals. So just like for example, heart rate, breathing rate, and blood pressure. So that is the example of the after surgery. So we need to go to the operation room and the operation room, and also the recovery room where the nurses closely monitor us. So and ensure adequate pain control as the person begins to fully wake up from the anesthesia. So thank you so much and God bless.
These 8 most common medications given for surgery. Pre-surgical meeting. Before undergoing surgery, you will meet with your surgeon, anesthesiologist, and nurse to review and gather lots of information from you. Healthcare providers will ask you the same questions more than once. They don't ask because they forget your answers or want to make you upset, but because they want to make sure the information is correct. Different providers asking the same questions can help reduce the risk of a mistake occurring. Medical mistakes are a huge issue. Number 1. Medical record like past surgeries and current health conditions. Number 2. Allergy history such as latex or iodine. Number 3. Current medications you're taking or recently took like insulin. Number 4. OTC or over-the-counter medications like aspirin or melatonin. Number 5, herbal supplements or vitamins like fish oil or turmeric. Prior medications issues. One super important question you will be asked is whether you've ever had any issues with anesthesia during a previous surgery. The surgeon will want to know if there are other family members who have a history for bad reactions to medications used during surgery. These informations help the doctor to know which medications to avoid. Number 1, memory loss. Number 2, confusion. Number 3, insomnia. Number 4, falls. Number 5, loss of coordinations. Number 6, dizziness. Number 7, drowsiness. Number 8, malnutrition, dehydration, and weight loss. Number 6 and number 9, depressions. Medications given for surgery. There are 3 different types of anesthesia. Number 1, general anesthesia. Number 2, regional anesthesia. Number 3, local anesthesia. General anesthesia. General anesthesia medications are given to make patients fall asleep, prevent pain from being felt, and prevent movement during surgery. Most major surgical procedures require general anesthesia, like appendectomies or breast augmentations. During general anesthesia, a medication is used to cause amnesia and prevent pain. It can either be given through an IV or as a gas. When general anesthesia is used, a breathing tube is placed in the patient's airway to help them breathe. Benzodiazepines are a drug commonly used in surgery. This class of medications is used to make patients sleepy, reduce anxiety, and causes amnesia. They are used alongside other types of anesthesia that help patients relax. The 3 most well-known benzodiazepines are Valium or diazepam, Ativan or lorazepam, verse midazolam. Local anesthesia. If you ever gone to the dentist to get a tooth removed or a root canal, the dentist use local anesthesia to keep you from feeling the pain. Local anesthesia is used to numb a specific area of your body. You are completely awake and aware of what's going on around you with local anesthesia. Local anesthesia is used when stitches are placed or a mole is removed. Regional anesthesia. Regional anesthesia numbs a larger are than local anesthesia. It targets specific bundles of nerves. While a patient is awake with regional anesthesia, they may be given other medications to relieve anxiety. 2 types of regional anesthesia are epidurals, given during labor, and spinals. Although anesthesia is one of the most well-known medications given during surgery, there are other medications that are used. Another type of medication used are antibiotics. That's all. Thank you.
So now let's proceed into medications given after surgery or post-operatively. After successful surgery, you will be transferred into the recovery room where you will be closely monitored. The nurse will watch your heart rate, blood pressure, oxygen saturation, rate of breathing. Once you are fully awake, you will be discharged home. If you are staying overnight, you will go to the recovery room, then transferred to a hospital. room at rest and receive pain management. So there are also other types of medication like analgesic. So analgesic are also known as a pain medications. They are used for controlling pain after surgery. Analgesic are available in different forms such as pill, uh, 6 liquid, suppository, and even as a patch. The strength of the pain medication varies and are adjusted for each individual patient. So powerful full pain medication are opioids. So commonly prescribed pain relief medication given into the hospital after surgery to a patient's brain includes the following: morphine, Dilaudid, and Fentanyl. So, in short, analgesic is commonly known as painkiller, are drugs that alleviate a variety of pains including headache, injury, and arthritis. It is usually form of pill. So, and analgesics are a type of medication that relieves pain without producing drowsiness. This is medication can be bought over the counter of the drugstore even without the prescription of doctor. So after surgery, analgesic may not be prescribed due to its after effects such as bleeding dose. It is important to have a note with your doctor. Also, the too much consumption of analgesic could be lead to problem. So next is antibiotics. Antibiotics, depending on your surgery a patient is undergoing, one or more doses of antibiotics are given before or during the surgery to prevent infection. Antibiotics are medication that kill bacteria. They are given either in the pill form of through and 6. The type of the surgery a patient is having determines the choice of antibiotics used. For example, a patient undergoing a spinal surgery may receive a cefazolin, so whereas a patient undergoing colorectal surgery may receive the following oppository several hours up to 2 days before the surgery, flagellai. Antibiotics are usually in the form of pills. Antibiotics are a form of medicine in which it kills or slows down the growth of the bacteria inside the body. Usually, you get antibiotics with the supervision of a doctor. So, antibiotics don't kill viral infection, only bacteria. Antibiotics can have side effects that could be treated to the body. Those one of the follow that a doctor has prescribed. So, common antibiotics are one of the are oral and ointment antibiotics such as a bacitracin. So next is anticoagulants. Another very important after surgery medication is anticoagulant. So anticoagulant are a medication that reduce the body's ability to blood clot. So this is a critical medication because one of the risks of surgery is blood clots. So most notably deep vein thrombosis, which is usually occurs into the leg. To prevent the formation of the blood clots, anticoagulants are administered through an injection under the skin through an 6 or a pill form. So example anticoagulants include Coumadin and heparin. So anticoagulants are given to those who have a high risk of blood clots to help them to avoid catastrophic disease include a stroke and heart attack. A blood clot is a seal formed by a blood to stop wound bleeding, so it can be in a form of injection under skin through pills. So common example of anticoagulants that are prescribed after surgery, that what I said, heparin and Levenox. So symptom reducing medications. Finally, the doctor might be prescribed other symptom reducing medications. These medication are used to ease other discomforts associated with having a surgery or side effect from the pain medication. So for example, Pepcid, Protonics, acid reducers, and ulcer prevention. So your doctor may advise you to take stool softeners or a laxative a day or two days before surgery to prevent constipation from the pain medication usage. So this charge from the hospital can be delayed due to the lack of bowel movement after surgery. Make sure to talk to your doctor about it. Symptom reducing medication are medication prescribed to lessen any ashes and pains after surgery. They are sometimes prescribed to lessen the side effect of after surgery and other pain medication. So these are the medication when you undergo surgery and its post-operation.
In this topic, we'll discuss about methods of pregnancy. What is artificial insemination? What is artificial insemination? Artificial insemination is a fertility treatment method used to deliver sperm directly to the cervix or uterus in the hopes of getting pregnant. Sometimes these sperm are washed or prepared to increase the likelihood a woman will get pregnant. Types of artificial insemination. Intracervical insemination. A very common question that asked by a couples trying to conceive is, what is intracervical insemination? This procedure is typically one of the easiest and least costly of the types of artificial insemination in humans because it mostly closely mimics intercourse. Semen is introduced to the opening of the cervix by a health professional with a needle syringe. After the sperm is introduced to the body, you might wear a conception cap for a few hours. The cap is meant to hold semen inside the body to raise the chances of successful implantation. Intrauterine insemination. You might be worried about the intrauterine insemination cost when you decide that you want to have a baby. Luckily for you, there are sliding scales of cost based on what you need from your healthcare practitioner. Insurance companies are also willing to cover some procedures. In intrauterine insemination or IUI, as it's also called, washed sperm is injected into the uterus with a catheter. Intrauterine insemination is one of the most efficient types of artificial insemination in humans and has some of highest success rate. This type of insemination is typically the most effective if you're under the age of 30. However, and older mothers might find better luck with other types of insemination. This kind of intrauterine tuboperitoneal insemination. This kind of artificial insemination is similar to IUI, but includes sperm being injected into the fallopian tube as well. Once the semen is put into your system, your health practitioner will put a clamp on your cervix that prevents semen leakage. This option is a great fit for couples with a mild male infertility or mild endometriosis because it bypasses the organs that are affected. You may be induced into ovulation for this procedure or any of the other insemination methods because the process guarantees that you'll release more eggs than usual eggs of better quality. Intratubal insemination. In intratubal insemination, sperm is introduced solely to the fallopian tube. Sometimes this procedure is called fallopian tube sperm perfusion. A catheter goes through the cervix and uterus and puts sperm directly into the fallopian tubes. An important part of all artificial insemination is monitoring your cycles and fertility. With this procedure, and with most artificial insemination, you should be sure that your health practitioner takes into account the type of cycle your own, whether it be your body's natural cycle or a fertility drug induced one. Two cheap approaches to artificial insemination exist: intrauterine insemination or IUI and intracervical insemination or ICI. Some women may also take medication to stimulate ovarian follicle growth and increase conception chances. Intracervical insemination or ICI. ICI is a type of artificial insemination that involves inserting sperm into the cervix. This is the passageway just outside the uterus. This approach can be used in a doctor's office or at home. The steps for this process include a woman will monitor her ovulation cycle using a calendar method, ultrasound by taking her temperature regularly, or combination of this. Sometimes a doctor may prescribe medication to induce ovulation and increase the likelihood a woman will release multiple eggs. Clomid is one commonly prescribed medication. A woman's partner will donate sperm for use, or a woman will obtain a sperm sample from a donor. A doctor will insert sperm into the vagina using a special syringe. Another option is to place the sperm in a cervical cup that inserted into the cervix stays for a designated amount of time. A woman will typically be instructed to lay down for 15 to 30 minutes. This ideally allows the sperm to move up from the cervix into the uterus. A woman can return her regular activities after this time. In about 2 weeks or slightly longer, she'll take a pregnancy test to determine if the insemination process was successful. And that's all. Thank you.
Good day everyone. I am Gisamona Malintad and I am going to tackle about the sexually transmitted infection. When we say sexually transmitted infection, it is caused by an organism, bacteria, virus, or parasite that can be passed from one person to another during sex or intimate contact. Most STIs are passed or transmitted between sexual partners through unprotected anal, vaginal, frontal, or anal sex. There are STI symptoms, and these are the unusual discharge from the vagina, penis, or anus, pain when peeing, lumps or skin growths around the genitals or bottom anus, a rash, unusual vaginal bleeding, itchy genitals or anus, blisters and sores around your genitals or anus, warts around your genitals or anus. There are three major causes of STDs or STIs. These are bacteria, including chlamydia, gonorrhea, syphilis, viruses including HIV, AIDS, herpes simplex virus, human papillomavirus, hepatitis B virus, cytomegalovirus or CMV, and Zika. Parasites such as Trichomonas vaginalis or insects such as crab lice or scabies mites. STIs are spread in the following ways: having unprotected without a condom vaginal, oral, or anal sex with someone who has an STI. During genital touching, through sexual contact between women who have sex only with another woman, from a pregnant or breastfeeding woman to her baby. Some STIs can be cured. Other STIs and blood-borne viruses such as herpes and HIV can't be cured, but they can be treated effectively. Vaccines are available for hepatitis B and HPV, which can be cause genital warts. To reduce your risk of getting infected, it's important to use condoms and water-based lubricant. That's all. Thank you.
Intrauterine insemination or IUI. IUI is a procedure that involves inserting sperm past the cervix and directly into the uterus. The steps for this process are similar to that of ICI, but are usually performed at the doctor's office and with specially prepared sperm. So these IUI steps where the process is similar to the ICI. The difference of these two is that the ICI process can perform at home or in doctor's office, while the IUI is usually performed at the doctor's office lang, so with specially prepared sperm. Additional steps include the semen is prepared or washed to remove potential proteins that could affect fertilization. This also makes the sperm more concentrated. Ideally, this will increase the likelihood a woman will conceive. A doctor will use a special instrument called a speculum to make the uterus easier to access. They will use a special thin instrument inserted through the vagina and place the sperm into the uterus. So, what is the process? Conceiving requires a man's sperm to travel up the vagina, through the cervix, into the uterus, and into a fallopian tube where an egg is fertilized. However, sometimes a man's sperm isn't mobile enough to make this trip. Other times, a woman's cervix may not be favorable to allow sperm to travel into the uterus. In these instances, and other situations, artificial insemination may help a woman conceive. So in the process, of course, it requires a man's sperm and able to to conceive, to help a woman to conceive. And a doctor may recommend a couple pursue artificial insemination, like after 6 months of having unprotected sex if a woman is older than age 35, or after a year of having unprotected sex is a woman is younger than age 35. What are the side effects? Some women may experience some cramping or light bleeding following the procedure. Others may not experience any residual effects at all. So you're lucky if you're not experiencing any residual effects at all. But of course, if you really want to conceive, syempre, dili na ka mag-mind sa mga side effects as long as makakonceive mo. And also, when the procedure is performed in a sterile fashion, the risk for infection are minimal. However, it's possible that a woman could experience a pelvic infection or inflammation after the procedure. So there's another side effect that important to consider. Taking fertility medications along with artificial insemination increases the likelihood for multiple children, such as twins or triplet. So this side effect is really important to consider, lalo na to those people who wants to have a multiple children, such as twins or triplets, diba? So if you have a lot of money, so why not, diba? Why not to try it? And then some common misconception about the artificial insemination and taking fertility medication is that they were associated with the greatest risk for birth defects. So this isn't true. So according ni siya sa American Society for Reproductive Medicine. So how successful is it? The success of artificial insemination depends on more than the approach taken. Factors include a woman's age, use of fertility medications, underlying fertility concerns. So ganina na-mention na ako ang woman's age. So these factors are chances to succeed conceiving. What are the benefits? Artificial insemination can be a beneficial and successful treatment for some couples who have trouble conceiving. Some of the conditions a doctor may recommend artificial insemination for include, of course, to those couples who have trouble conceiving and want to conceive, you can consider this process. It is very highly beneficial and successful treatment, especially to those couples where a man may have a genetic defect and using donor sperm is preferred. Men with a low sperm count men with low sperm motility, women whose cervical mucus may be unfavorable to getting pregnant, and women with a history of endometriosis. So, this artificial insemination also provides the benefit that a single woman or a same-sex couple can get pregnant using donated sperm. So, yun. And the last slide, the alternatives to artificial insemination. If a woman hasn't gotten pregnant after 6 cycles of artificial insemination, she may wish to evaluate her additional fertility options with her doctor. Also, some women may be unable to do artificial insemination due to underlying fertility problems that make conception unlikely. For example, a woman who's had both fallopian tubes removed won't be able to get pregnant via artificial insemination. So, if ever na mga ani nga case, so a doctor may recommend an additional fertility treatment called in vitro fertilization or IVF. This treatment involves extracting eggs from a woman and sperm from a man. So these are sent to a laboratory where sperms are used to fertilize an egg in a laboratory setting. So the fertilized eggs are allowed to grow as embryos. A doctor will then transfer an embryo or embryos into a woman's uterus in the hopes an embryo will implant and a successful pregnancy will occur. So, guys, so if you have a lot of money, diba, why not to try it? And of course, gi-mention ako ganina nga pwede siya kanit bidan at home, diba? Ang kaning artificial insemination. But also, i-consider po nato ang the benefits of an at-home artificial insemination is that a woman can be in the privacy of her own home, diba? And most commonly, a practitioner such as a midwife will use an unwashed specimen that's obtained directly and immediately from a man. So, at home, inseminations aren't as regulated as they are at a medical office. So, kinahanglan i-consider po nato na for this reason, it's important that a woman or couple truly discuss the procedure and its risk and benefits with the person performing the insemination. So, at home, a home environment increases risk of infection over a clinical environment. So, kung ingon nga dili lang mo sa koan. So I'm just stating the fact sa pwede mahitabo. But also, pwede man po siya maka-purchase at home og mga insemination kits. So these kits come with containers of semen and syringes to collect the semen and insert it through the vagina. So yun. So while the procedures is fairly straightforward, it may be difficult for a woman to perform on herself. So it can take several attempts before successful conception. So the outlook of this artificial insemination is that it is a treatment that provides many couples, including same-sex couples and single women across the country, the chance to get pregnant after having difficulty conceiving. If a woman has had difficulty getting pregnant or wishes to receive assistance in conceiving, she should talk to her doctor and fertility treatment options. Diba? Aron ma-secure ang ato ang safety. Diba nga, safety first.